You're listening to the Veterinary Innovation Podcast.
You're listening to the Veterinary Innovation Podcast. My name is Sean Wilkie, and along with my awesome co-host, we interview the innovators in this space every week. Ivan, please go ahead and get us started.
Hi, I'm Ivan Zach, and I'm very excited to interview today Dr. Sarah Machell. Dr. Sarah is a 97th graduate of Ontario Veterinary College. She is a veterinarian with 25 years in practice of small animal veterinary medicine, independent practice ownership, and veterinary business operations. Always fascinated by tech and potential opportunities that marrying tech with veterinary medicine could afford. She found her perfect role at Vetster, where these two passions have collided. Dr. Sarah, welcome to the show. Thank you for finding the time.
Thank you for having me, Ivan. I'm excited to be here.
So the topic for the episode is virtual care, and we've been around virtual care
100 times.
I've been around it.
Yeah.
100 times. And but it's because I haven't seen it done right, and it sounds like what you're doing is done right. So since the inception of VIS, the Veterinary Innovation Summit, it's a continuous conversation. Now there's an association, virtual care, and yet there's still resistance from the associations in different states, different jurisdictions. So can we start by just, if you can tell us what Vetster does?
Yeah, I'm excited and happy to share that. And certainly I would fully agree with you that there's been a lot of hiccups and false starts and not particularly effective shots at virtual care to date. But I would really say that Vetster's unique approach is really making it happen in a really great way. And we are really unique in this space, such that we are an online marketplace for pet owners to search for veterinary care and book with independently operating veterinarians to provide qualified, in-person video consults for the care for their pet. And we're really unique in this marketplace presentation. No one else is operating in the virtual care space the way we are. We are a really high quality software platform that is allowing veterinarians to utilize our software to connect with pet owners and operate their own virtual practices. And for that reason, we're really feeling very strongly that we're really making steps forward to democratize the access to care and to democratize veterinary care in general, leveraging amazing veterinarians and great software to really do things a little bit differently than anyone else's.
So because we're on podcast and there's not much visual, and obviously everybody should go and check out vetster.com. So everybody go and check it out right now. But take us through the experience. So you said it's a marketplace. So as far as I understand, marketplace, there's two sides to it. So there's veterinarians that provide care, and then there's pet owners that are looking for vets. But what is that experience like? So if I'm a pet owner and I just heard this podcast and I'm going on vetster.com, what can I get? What services are available? And how does it work through telemedicine? Because there's only limited things that you can do through telemedicine. So what is available? What is not available?
Great question. So as a pet owner, you would come to our site and you would be able to search from our thousands of veterinarians by adding some search criteria. So depending on your location that you're situated in with your pet, so your state or province, depending on what type of pet you have, or do you have a dog, a cat, a cockatiel, a snake? You can search, you can refine your search to narrow down the veterinarians that are experts in those areas. And then you can further refine the search looking for veterinarians who may have a specialty in, small animal dermatology or an interest in reptiles or that type of thing. And then you can choose your veterinarian based upon the day and the time that you're looking to book an appointment, as well as you can browse the veterinarians sort of narrowed in your filter by their cost. So veterinarians on our platform are independently operating, as I referred to earlier, and they have complete autonomy over their consultation rates. And so If you have a cat and you're in Nova Scotia, then you can surface veterinarians to see what their consultation fee is, and then you can proceed to book through there. And to your point, Ivan, about what can be done over virtual care, our platform has a very intelligent algorithm, because virtual care regulations vary dramatically across every province in Canada and across every state in the United States. And in some geographies, like Ontario, where I'm located, for example, veterinarians can actually fully practice telemedicine through virtual care. So they can establish a VCPR. They can, at their discretion, speak to a diagnosis and a prescription if it's appropriate. Whereas in Nova Scotia at this time, veterinarians are limited to providing support and advice and guidance, because the establishment of a VCPR via virtual means is not permitted. And so as a pet owner, if you go onto our website, our algorithm will surface this information as to the potential outcomes from an appointment with a veterinarian, so that you understand, if you're in Nova Scotia, I can't get a prescription, but I can get a whole lot of really qualified advice by speaking to a veterinarian. Whereas in Ontario, it is surfaced to the pet owner. Prescriptions are a potential outcome in your region based on the veterinarian's discretion.
So cool.
Okay, but there's sometimes, let's say we got a consultation, and it's not everything that you obviously can figure out over the telemedicine. So,
Right.
so from that point, maybe I would need some sort of diagnostics, the X-ray or the blood work. How does that workflow work from there?
Absolutely. Telemedicine and virtual care are not for every presenting complaint. And so if it's a case that requires escalation to an in-person care, that's between the pet owner and the veterinarian to discuss. Because our internet has no boundaries, the connection is between pet owners within a province boundary. And so if the pet owner and the veterinarian happen to be in a geographical area where they are able to connect in person, then they can make those arrangements and refer that pet owner to the practice. Alternatively, if it's geographically not possible, then the veterinarian would support that pet owner to understand what to look for when going into a clinic. Giving them guidance to say, these are the things that you want to ask, these are the things you want to have done, and or have those things done with your in-person veterinarian, and then come back to me and let me support you in understanding those diagnostics and those next steps. And so part of the vision for me and for Vetster long term is that opportunities like our platform are actually providing extra support for pet owners to take excellent care of their pets. And my vision long term and my imagination is that the really savvy pet owner in the future is going to have their in-person vet, and they're going to have their virtual vet, and they're going to complement the care of that pet, through these two modalities.
Super cool. So a bunch of questions. First, your service is available just in Canada?
No, actually, our platform is available for pet owners all across North America. So we have veterinarians in all 50 states of the US, all provinces of Canada, and we actually also have our platform is live in the UK.
Oh, cool. Yeah, it's really, really neat. I've been on your platform this morning. So then the next sneaky/tricky question is, let's imagine that I'm in Ontario, even though I'm in Nova Scotia, and I come in and I get some virtual care and get a prescription. I go get it filled. My pet still has a problem, but now I'm traveling in Nova Scotia, and I go back on the website, and can I still get that care? And can I also, from Nova Scotia, pretend that I'm in Ontario and get all of the care that I want? Is that all able to be done, or is there any safeguards for that?
So your account that you set up on Vetster is your home address, and that is where the connection to veterinarian is from. And so, for your first example, if we take this back to in-person traditional veterinary care, if you were an Ontario resident, Shawn, and you went into your local clinic and you saw the vet and medications were prescribed and you had a relationship with them and you were traveling to Nova Scotia, you would probably reach out to your in-person Ontario veterinarian for support and guidance and be able to continue that relationship. And so truthfully, it's no different if you have an account, your home base is Ontario and you're traveling, you can still connect with your Ontario Vetster veterinarian. Could nefarious activity, if can we control folks who might want to tweak the system happen? For sure. I mean, there's only so much we can do to ensure that folks are being truthful. IP addresses are not something that we can necessarily completely navigate.
Yeah, no, that's a great answer. Thanks.
So I am a pet owner, and I want to hear the advice from a veterinarian. How does the platform make sure that these people are true veterinarians and they are true licensed professionals from that area? Is there something that the platform does to recognize that?
Yeah, that's a big part of some of the opportunities within my role for the organization. So as a veterinarian, you would head to our site if you're interested in setting up a profile. You would input your initial information. We ask for licensing information, and then there's a behind the scenes background check done on veterinarians before they are approved and made available for pet owners to book. So there's a whole quality assurance program that is sort of behind the scenes in our software that we work with to ensure that veterinarians are licensed and that they have no outstanding disciplinary actions on their license and that sort of thing.
Makes a ton of sense. So tell me a little bit what the journey's been like so far for Vetster. It's really amazing and quite impressive that you guys have so many veterinarians and such wide representation across Canada, the US, and I guess the UK now. And then maybe dovetail into that, what your vision for Vetster is and why people that are veterinarians that are practicing telemedicine should maybe examine looking at this platform play instead of trying to internalize telemedicine themselves.
Oh, that's a great question. And I have lots to say about that. So I might ramble on for a moment or two. I think that we came to the space with a pretty unique offering. And as I referenced it initially, one of the things that, I'm really passionate about is the fact that we're bringing this down for an opportunity for individual veterinarians to really, practice their own practice and utilizing our platform to do so. And I think one of the things that's really unique about virtual care in general and our platform in particular is this concept of being able to work remotely. Veterinary medicine and veterinarians, it's not a profession that has inherently lent itself for working from home. And as we all know, being in this space, the veterinary professionals are so challenged. Burnout is real. Attrition from the occupation and the profession is at highest levels. And this opportunity to be able to work from wherever you are on your own terms has really resonated with the veterinary community. And this, the ability to extend career paths within the profession is really enlightening and exciting for me personally. And it's what we've really seen to have resonated with the veterinarians who are exploring the opportunity on our platform. And so if you're interested, as a veterinarian in virtual care, the flexibility of using our platform such that, you don't come to our platform and we don't dictate that you must work X number of hours. We don't tell you how many appointments a day, a week, or a month you need to take. It's all under your control. It's completely flexible. And really, that is just not something that our profession has been known for historically. And I think that it's a real, we see all types of personas in veterinarians on our platform, from the more recently graduated folks who are just looking for a little more flexibility, digitally sort of native oriented, to people who are kind of ending their career or rounding out their career but are not ready to completely give up practice. That we're seeing a lot of folks that are kind of retiring from practice and practice ownership, really interested in learning about this and extending and continuing to to be able to help pets and pet owners. And I think that's why we've seen such success. And, I personally, although I'm the medical director and involved in a lot of other things in the company, I also have a profile. And I can tell you, I love doing consults because it's really rewarding. The clients who are coming to the platform are so grateful for the opportunity and are really loving the experience, the one-on-one with the veterinarian and that skilled advice versus the Dr. Google search.
That's so cool. There's so many things that come to mind when we talk about this because, just as an example, so a friend of mine, he's my gym buddy, came by and he just got a kitten for his family. And then, he was asking where he could get a deworming. And then he knows I'm a vet. And I said, look, I'm licensed in New Brunswick, but I don't practice. So I don't have a practice. I don't have an account with vet purchasing. I don't really know how it works these days. So I said, your best bet is just to go to the vet clinic. Well, in St. John, there's 9 clinics total. 9 clinics. He called every single one, told him that we cannot take you as a new client. Bluntly refused and said, we're not taking on new clients because we don't have the capacity. So what do you do? And that kind of brings me to the point that the whole virtual care and VCPR, if Ontario never had problems in the last 3 years, why wouldn't we go across Canada and essentially take that as an example? Because right now, if let's say I am a retired vet from New Brunswick and I move to Hawaii, but I'm still licensed in New Brunswick, I could do that, right? I could be actually sitting on my vacation or my retirement home, still being licensed in New Brunswick and still help folks like my gym buddy and do it 3 hours a day or something like that. But it would still help with the capacity of non-existing veterinarians across Canada and US.
Absolutely, Ivan. And I think this could be a whole other conversation and podcast. How do we get the regulatory world seeing the innovation world and the potential? How do we communicate and direct and support the evolution of the regulatory community away from the fear that is being presented so often about what could possibly happen virtually, to really understanding the opportunity to support pets and pet owners and veterinarians in the delivery of this type of care. Ontario has really led the way. They've led the way in Canada. They've led the way in North America. And truthfully, they've led the way globally. And we are still evolving our regulations, but we've learned so much in the last. So Ontario was the first geography to establish or enable a veterinarian to be able to establish a VCPR via virtual means in 2018. And then come the pandemic, they escalated that and they evolved that to allow veterinarians to be able to prescribe. And just recently, they've taken that from an emergency situation to a permanent regulation, enabling veterinarians at their discretion to be able to prescribe medications. We still have work to do. We're still learning. These guidelines in Ontario are still going to be evolving as we continue to prove and have the data that there really is no negative and ill effects happening. But we need more conversation at the government, at the regulatory level, to shed light on this opportunity in North America and globally.
Yeah, it's so true. I mean, we have literally an emergency in veterinary medicine.
We do.
So much capacity has been taken away by people retiring. New clients have showed up. And so it seems like, this is one potential way out of this massive problem that's facing the industry.
One of the things I like to say frequently is virtual care, telemedicine, it is not the only solution for the crisis that's affecting our profession and our pet owning community, but it is a very solid one. And it's one that we really need to escalate the importance of to the regulatory community. And one little anecdote I love to share when we're having this conversation that was shared with me from the directors of the College of Veterinarians is that in 2021, there was a 40% increase in complaints to the CVO, disciplinary complaints. And not one of those complaints was centered around care that was administered virtually, but almost all of them were centric. The common theme to the complaint was rooted in access to care challenges.
Wow. Well, listen,
I can see
That
that.
was an amazing episode, Dr. Sarah. Thanks for joining us. We like to wrap up the same way every time. So we got a couple questions for you. First is a YouTube TED Talk, some kind of inspirational piece of content that you've come across that you'd like to share with our listeners.
Well, I just recently finished, it's not a veterinary innovation book, but I found it so inspiring. So I just recently finished Matthew McConaughey's Greenlights. I'm not sure if either of you have had the opportunity or if any of our listeners have had the opportunity to read it, but he's a fascinating guy, really led with his life with, thinking outside of the box and so creative. And I just really took a lot out of that read. So I'd highly recommend it.
Excellent. And the last question that we will ask, is there a guest that you would recommend to be on this podcast?
There certainly is. So there's a young woman that I've had the pleasure of meeting and working with a little bit, based on the west coast of our country in Vancouver. Her name is Elise, and I'm not going to be very good at her last name because it's challenging, but Bekelic Grick. But she's the founder of Felix and Fido, and she's doing a really unique thing for vet techs and for pet owners. And there's a tech component to it and an at-home nursing component to it. And I really love her thinking and her strategy. And I think she'd be really great for your podcast.
Thank you so much for listening to the Veterinary Innovation Podcast. If you want to hear about our new episodes, please follow us on any social media channel. Also, you can check out our website at veterinaryin.to. See you next week.